These are our key concerns that we would love to see government address in financial year 22-23. One, the increasing public expenditure. We note that of the total domestic revenue of financial year 22-23, 73% of the projected budget is going to go towards consumptive expenditures, and only 27 will be available for development expenditure. So you can see the magnitude. 73% of our upcoming budget is going towards consumptive expenditures. Here we are looking at, and only 27 will be left for development. Again, when you look at the budget again, a total of 88 billion has been earmarked for operationalization of the new administrative units. We are not against this, for these monies to be given, but our concern is government needs to put on hold creation of new administrative units, because we as a country, we don't have enough resources to fund these new units. It puts lots of pressures, and even the current administrative units that are running are not adequately financed. So continuous creation of this is something that government needs to put a stop to. So we call upon government to expedite, especially the rationalization process, by providing a clear roadmap. Remember, colleagues, government came up with a pronouncement that they're going to rationalize some of these agencies that are duplicating their functions. But since that pronouncement, we haven't seen any clear roadmap that has been put in place by government. And our call here is, we want to see a clear roadmap released, especially by Minister of Public Service, to clearly state when they are going to start this rationalization process. And because this process is key, one, in eliminating redundancies and improving efficiency in government. Another issue of concern is the slow implementation and harmonization of the program-based approach. Yes, we do acknowledge the program-based approach to budgeting is something which is critical. And however, our biggest concern is there is still a big hangover which is hanging around in this country, especially on the sector-wide approach. Most of these agencies are still stuck and are thinking and working along sectors. For example, most of the districts in this country don't have approved district development plans. The program-based approach was envisaged in the National Development Plan 3 and was meant to increase coordination and harmonization among programs for better linkages of resources to results and reduce the silo approach of working. So this being the third year of implementation of the National Development Plan, we call upon the National Planning Authority together with the Minister of Finance to expedite this process of implementing the program-based approach. In addition, a change management strategy should be adopted and shared with other MDAs to guide them as they migrate from the sector approach to the program-based approach. Another issue of concern is the unclear criteria for fund allocations for the parish development model. Yes, as civil society organization, we appreciate government for coming up with a parish development model, which is key in the social transformation of this country. However, our biggest concern with this model is the criteria that government is using to allocate these funds. For example, in financial year 22-23, 465 billion has been earmarked for operationalization of the pillar of financial inclusion. Now, there are so many pillars in the parish development model, but government has marked only one pillar in financial year 22-23, and it's proposing to allocate a total of 465 billion to operationalize it, which is good. But however, our concern is what criteria was used, because as of last year, government had a proposal of giving each and every parish 100 million. But we well aware know that parishes have different dynamics. For example, Mutungo Parish in Nakawa Division has a population of 64,663, while a parish in Ajumbani called Ibiaworo has on a population size of 892. So now you can see this kind of disparities in population size. And each and every parish has its uniqueness. So this proposal of giving 100 million a pro rata across to each and every parish, to us, we believe is not something which is good. We appreciate the money. However, we want to see government promote equity in terms of allocation, so that parishes which are big in size get fairly more resources compared to parishes which are small in size. Another key issue that we want, so as civil society organization, we are calling upon government to prioritize funding to Ministry of Health, Uganda Blood Bank, transfusion services to increase blood accessibility, safety, availability by recruiting and deploying health workers in key blood collection and transfusion, so that we see an improvement in the health systems and service delivery. Critical issue again here is the absence of health insurance scheme, which my colleague from SEHAD is going to expound more on this. We know that access to health services continue to be a burden to the ordinary citizen in this country. With the increasing cost of health care and rise in out-of-pocket expenditures, so many Ugandans are spending heavily on health. This was witnessed during the period of COVID, where someone had to foot a bill of close to 100 million because they have been admitted in a health facility and they are being treated for COVID. So according to the National Household Survey Report 2020, only 3.9% of the population have access to health insurance. You can see the size, the percentage is quite small, only 3.9. And this 3.9 are majorly those of us who are working in formal employment, but the majority who are not in the informal sector don't have this insurance package. So our call is government needs to fast track the enactment of the National Health Insurance Bill into law. So once this is done, we shall be moving on a right path towards achieving universal health for everyone. Another key issue that we want to bring to attention of the media is the inability of small and medium enterprises to recover. We are aware that COVID-19 impacted so heavily on these small and medium enterprises, majority closed. And remember, this sector is one of the leading sector when it comes to employment of Ugandans. So our call here is government needs to prioritize. For the economy to fully recover, government needs to prioritize funding to SMEs through provision of low-cost capital and adequately capitalizing Uganda Microfinance Support Center. We want to see these SMEs being positioned to get cheap and low-cost capital for them to recover. If need be, there needs also to be a bailout, a clear bailout. That needs to be a strategy that needs to be put in place so that SMEs can be in position to get low-cost capital to aid in their recovery.
The question of financing for health has been a continuous challenge for this country. And in 2016, government put in place a health financing strategy with the hope of putting in place mechanisms that will help the health sector cope with a growing population, but also with a growing financing. Unfortunately, in terms of practice, things have gone really bad. One of the things that the health financing strategy anticipated was to have in place a national health insurance scheme that is practiced across the world. Actually, World Health Organization says that for you to achieve universal health coverage, health insurance is key. And like the statement has clearly indicated that in Uganda, we have only 3.9% of the population insured, and that is largely corporate. At the height of COVID, that number actually dropped to about 2% because a lot of corporates were downsizing. And so the number went down. Our prayer is that we have in place a national health insurance scheme that helps everybody when they have a crisis. Kenya, Rwanda all have health insurance schemes. If you look at Kenya currently, we just adopted theirs lately. Their health insurance coverage is at 18%. If you look at Rwanda, which started a little earlier, they're at 86%. And that means that when you go to a health facility, you're able to at least get a fair health service delivery mechanism within public health infrastructure. So we believe that it is important that government prioritizes the National Health Insurance Scheme Bill, because without law, you cannot begin to implement national health insurance. There have been contentions. You remember Parliament passed the bill, it went to the President, he didn't assent to it, and it is back. And yet the process has to start afresh. So we are thinking that this is a critical issue that as a country, if we are to deal with our continuous problems of health financing, we need to deal with. Currently, by the way, government only contributes about 15% of health expenditure. Here we are talking about expenditure generally, not the budget. We are talking of how much money is spent in health. The one you pay from your pocket when you go to health, the one your health insurer pays, the one the donors contribute, that all together constitutes what we call health expenditure, okay? Of that, you only have government contributing 15%. Remember, health is a social service, which is supposed to be a preserve of government. So if government is contributing only 15%, then you know that when you fall sick in this country, you're on your own. You sort yourself. Instead of thinking that, yes, I'll go to a public health facility. That explains why when you go to a health facility, you're unlikely to find a doctor. You're unlikely to find medicine. Because all these things have cost implications that must be borne by resources. So since government has consistently not been able to secure resources, it's important that we look at alternative ways of getting money to finance our system.
To request the government to make a significant investment towards recruiting more extension workers, but also retooling them. Maybe away from that, I would like to comment about the experiences of COVID-19 towards the agro-industrialization program. We all could have witnessed the atrocities that COVID-19 caused the program. And of course, looking at His Excellency's speech, real economy versus vulnerable economy, we ought to recall that agriculture was at the center. But of course, looking at how much has been allocated to the program, which is up over 1.5 trillion against the 1.4 trillion that was for the previous financial year. Yes, we ought to make a commendation there, but we also wish to say that we are concerned that this money, this proposed allocation is not sufficient for us to realize the goal of the program, but also to realize the issues of food security and nutrition in the country. I've just said that during the times of COVID-19, we saw that the country did not have a clear program to feed the people. So as we make this press statement, we ought to still make this modest appeal to the government that this was a wake-up call to us as a country, and we ought to have learned from such experiences. Therefore, we ought to request the government to reinstate the national food reserves, but also have a clear program should such calamities befall the country.
We would like to applaud the government of Uganda and all the partners that have contributed to investment in nutrition, the donor community, the civil society, the academia. If we're talking about securing the future for Uganda, we need to see increased investment for nutrition. When we talk about increased investment for nutrition, we're talking about financing and human resources. Today, we still have local governments that do not have nutrition officers, that do not have functional nutrition coordination committees. And if we're to move and improve the health of Ugandans, one of the things we need to note that a well-nourished population is a productive population. If your population is malnourished, if your population is suffering from hidden hunger, is starving, then you are at risk of food insecurity. It will be embarrassing for a country that is endowed with food like Uganda to be talking about food insecurity. So to address the issues that we have in the nutrition and the water sanitation sector, we really need to see increased investment. We know that as a country, we are on track in reducing stunting by 10% as provided for under the Malabo Declaration. But we need to do better in the 2022-2023 budget. And for us to be able to address issues of nutrition, we need to prioritize nutrition-sensitive agriculture by looking at nutrition-specific interventions. We also need to promote climate-smart agriculture. And we cannot promote climate-smart agriculture if we do not have the extension workers at local government level to support the communities. So we also would like to see, I know that some of my colleagues will talk about health, because we all saw the challenges that we faced with our health sector during the COVID pandemic. But strengthening the health system is very critical for any country to thrive. So we would like to call upon government to increase investment for nutrition, to mainstream nutrition and WASH, because it's very critical, and to prioritize on nutrition-sensitive agriculture and also nutrition climate agriculture, so that we address the risk of food insecurity.
Comment that MAIF, Minister of Finance, Minister of Agriculture, Minister of Trade, and also need to digitalize agricultural market information, commodities, to inform production and investment along the value chain. Because we noted that almost all the acts which have been passed, including the Coffee Act, they are talking about digitalizing the coffee farmers. But this digitalization should not be isolated. We need to have a harmonized database for this ICT, and also to have all value chains moving that direction. We also recommend that MAIF and MTIC, or Minister of Trade, should increase the number of commodity user facility centers and spread them across the country, situated within the communities. This is something when it comes to value addition. Many times we cry, Kenya is ahead of us, Kenya is doing so much and this, but as government has invested a lot in terms of value addition. So these common user facilities are worth investing in as government. We take note that the Agricultural Cluster Development Program has really tried, especially in this financial year, to support cooperative set up value addition equipments. But this should continue, and more needs to be done towards agro-processing and also value addition. We also recommend that MAIF should engage Uganda Development Corporation and Uganda Development Bank to subsidize on the cost of food grade materials. I know in this country, many of the food which is eaten, especially when it comes to maize, may not be free of aflatoxin. You remember the Kenyan ban we had. And also the aspects of steel, because most of the fabricators of this machinery are using the normal steel. If they don't put their magnets, we run a risk of getting cancer in the long run. You know, many children have returned, but where is the portion being bought? So we need this aspect to be really focused on this financial year. We have had challenges, although we've moved to the program-based approach, but still, in terms of access, smallholder farmers' access to agricultural finance is still a challenge. So we request that government should ensure that the COVID-19 stimulus and recovery funds to agriculture sector reaches the smallholder farmers through supporting the circles and also the cooperatives. We know there's more capitalization of UDBS, Uganda Development Bank, sorry. So this money should really be in line of supporting smallholder farmers and seeing that they access it. My colleagues have also talked about the Microfinance Support Center. More should be done in that area. And also the awareness of the farmers to know that these funds are there, and then they can tap in and see that we increase and support the agricultural sector. We also note that Minister of Finance should establish appropriate public and private financing options for agricultural mechanization, with supportive follow-ups from MAIF, of course, and also Minister of Trade, universities, and the private sector, because this is very critical. We may not transform this area of agriculture without mechanization. Lastly, broadly under agro-industrialization, my colleagues has raised, we are now in the third year of the National Development Plan. I want to just add something by noting that MAIF should operationalize and strengthen the program working groups. Previously, we had the sector working groups. Of course, these have ceased, but now we're in the program approach. So we need to see that these program working groups are established and strengthened. And also the Prime Minister, as well as the National Planning Authority, should support or should clarify on the mandates of each ministry, department, and agency to avoid duplication and conflicts. Because we've noted that there's still misunderstandings when it comes to this agro-industrialization and also the program-based approach, which we are in now.
We'd be interested in seeing in the budget framework paper. Some of them, the Ministry of Education released the costed school reopening strategy around December 2021. But as the budget framework paper is now, the costed thing in the medium, short, and long term are not included, because for school reopening to happen, you know what has happened, for instance, the issue of teenage mothers and students who are now pregnant. They need reintegration. In 2020, there was a study that maintaining a pregnant student in school requires about 30,000 more than a non-pregnant girl. So having that one costed into the school reopening plan would be very crucial for us to be able to maintain our pregnant teenagers and those who are breastfeeding in school. Then we know Uganda is one of the largest refugee hosting districts, and according to 2006 Refugee Act, refugees are given similar rights as citizens. So the issue of the education of refugees is going to be very crucial, and for them their education was worse affected. So how the education response plan by the Ministry of Education is given the required funding for us to ensure that the refugees within our country are able to access education and achieve it is going to be really crucial. Then, because of COVID-19, there is a double-pronged effect. One on teachers. Some teachers have lost the motivation to go back to class. Equally, some students have lost the motivation to go back to class. So we are calling upon the government that in planning and in budgeting for FY 2022-2023, the issue of beyond reopening schools, how we put in money and budget for motivation and incentivizing the teachers and students to go back to school. And that one can be better achieved through community and mindset change program, but has only been given 70 billion shillings. And that one, I think, is a drop in an ocean, given how much we risk to lose if we have a non-educated and illiterate generation of teachers. Then, of course, planning for education reopening is not only for this FY. It has to go beyond this FY. We are going to be looking at congestion in schools because of the 2 years we've lost. Yet the school should be people come in, people get out. So we would request that we begin the planning process for a congested education system through, for instance, beginning to set up in the costed plan for the Ministry of Education in school reopening. We are talking of having temporary shelters and structures, tents, to accommodate the larger than usual number of students, but would propose that we begin the process of putting up permanent structures for these schools and these students. As my colleagues have said, every shilling counts. The capitation grant cannot be as usual. For instance, now where we never needed sanitizers, schools will require sanitizers, will require face masks, will require hand washing facilities, and all of these would expect them to be paid for under the capitation grant. So the capitation grant as is now and has been is inadequate, and we would call for an increment in the capitation grant for schools to be able to capture in the COVID-19 instigated requirements for schools to fully reopen, and we prevent a surge in cases as it happened last year in May.